Good evening, everyone. Myself, Dr. Rahul. Welcome back to Raaonline. And today we are going to discuss about very important monitoring, that is invasive blood pressure monitoring, that is also known as IBP. So, in different critical care units or different ICUs, different neurosurgical cases, cardiac cases, in different ICUs, we definitely saw this invasive blood pressure monitoring devices in the graphs, in the monitor, and also it is a standard based blood pressure monitoring because it will give a real time blood pressure monitoring from bit to bit, and because there will be a very bit to bit variation in the blood pressure, we have to focus on invasive blood pressure monitoring when we are doing complicated cases like this cardiac surgery cases or thoracic cases or neurosurgical cases, or also to aspirate ABGs. We have to put a arterial line like that. So this has a different significance in exams, like invasive blood pressure monitoring graphs are generally asked in OSCE. Second thing is that in the Viva rounds also, whenever you are taking to a ICU or to a OT, mostly you will not take to OT, mostly you will take to ICU rounds. When in ICU rounds, if the patient is having attached this blood pressure monitoring, they will definitely ask about the graphs. There are some fundamental concepts like resonance, damping. So these are the fundamental aspect I will definitely cover. Also, this invasive blood pressure monitoring is also used to calculate, or they will also used in the to help about the fluid requirement or fluid measurement, or to give the intravenous fluid whether the patient is fluid responsive or not. In comparison to the positive pressure ventilation, there are so many literatures where we can study whether the patient requires fluid or not. So by invasive blood pressure monitoring, there are so many complications of also to put a arterial cannula. There are so many complications. There are so many prerequisites to put a arterial cannula, like Allen test and modified Allen test are there, where we can do before putting a arterial cannula to know the patency of both radial artery and anal artery. So in this background, in this aspect, let us continue with the invasive blood pressure monitoring. So what are the components we required to do this invasive blood pressure monitoring? So we required an intra-arterial cannula for sure, a tubing that should be incorporated with the infusion system to prevent blockage, a transducer is the main component of the IBP measurement, microprocessor and display screen, and mechanism of zeroing and calibration. So we zeroing this, what is the concept of zeroing and calibrations? We mostly place the transducer at the heart level, and we expose the transducer to the atmospheric pressure. So the atmospheric pressure is the reference point with where the pressure will be zero. Why we keep the transducer at the heart level? Because if you keep the transducer above the heart, the blood pressure recording will be very much less than the actual values, and if you keep the transducer below the heart level, it will seem that there will be a higher blood pressure in comparison to the normal blood pressure. So it is always advisable to keep the transducer at the heart level. Problems occur when we do different positioning in the OT or ICU. Suppose we have kept the transducer at the heart level, and suddenly there will be a head up position or head down position or Trendelenburg position, reverse Trendelenburg position in the OT. The heart rate will, the blood pressure will varies. We have to again readjust the transducer. Sometimes the cannula or tubings are blocked. We have to flush it by doing different flush test. Through this our incorporating infusion system, we have to flush the cannula, and we can see the tracings of the intra-arterial pump, intra-arterial blood pressure monitoring graphs in the screen. From that we can know whether the tube is patent or whether the cannula is patent or not. So and also once we put the intra-arterial cannula, we can repeatedly aspirate the ABG, which is very much required in a cardiac surgery patient. So these are all the components and uses of the intra-arterial blood pressure monitoring. So this is the component. See the tubing, there is a three-way cannula through which we can put the infusion saline through one line, and we can connect the transducers. And there is a two cannula. So one through is connected to the cannula and another is connected to the flush system. So this is the transducer. This is the main component of the intra-arterial blood pressure monitoring.